Dr. Alhawsawi.
Assalamu alaikum wa rahmatullahi wa barakatuh. Thank you, Dr. Suhail. And let's start with, I want to thank the organizing committee and the whole society for having basically invited me and for all the exciting things that you guys are working on doing. I think these are exciting times in the kingdom. I think it is very interesting to be here in Saudi Arabia these times. I think we have an opportunity to really positively improve our healthcare system and transform it in a way that it should be, and to take leadership in the region when it comes to healthcare and dare I say globally as well. I'm going to start with a story. So this is a true story. It's not a spine surgery story, but everyone could relate to it. So this is a 21-year-old lady. This story happened about a year ago or so in one of the hospitals in Saudi. She had twin pregnancy and she was in her third trimester. Presented to the emergency department just about a week or so before she was at term with antenatal hemorrhage. So she got admitted, and the treatment that she got was basically expectant management. So over a week time, she neither underwent cesarean section nor she underwent induced labor. On day 7 of her admission, she went into spontaneous labor. She ended up dying, and both babies died, without getting into kind of technical reasons of why she died. This patient and her both kids could have been saved in another place, in another setting, with another professional. So, we can go on and on about different stories of why safety is extremely important and why is it kind of the basic minimum that our patients deserve. أنا دائما أحب أبدأ بالآية هذه الآية رقم من 32 من سورة المائدة ومن أحياها فكأنما أحيا الناس جميعا. So for those of you who don't speak Arabic, the translation is, if you save one life, it's as if you saved the lives of man, of all mankind. So I think that should be our true north in the healthcare system, period. I'm a practicing hepatobiliary surgeon. I will continue to practice, but I think patient safety should not be about a center, should not be about an institution. It should be about us in healthcare system, and this is why I think it's everyone's responsibility to improve safety. So I'm going to talk about 3 different areas. Why do we need patient safety? So some basics about that. Linking up of the Saudi Patient Safety Center with all the transformation activities and the Vision 2030, and then discussing the Saudi Patient Safety Center in kind of just brief. So again, that's another story of a newborn that died by what look-alike, sound-alike. So the treating physician prescribed ranitidine, but then she ended up getting pancuronium. Another true story in Saudi Arabia a few years back, and she ended up basically dying. It is not just a Saudi problem, it's a global problem. At Duke University Medical Center in 2003, this was a type O recipient who had a lung and heart transplant perfectly, people were patting themselves on the back. Everything went perfectly fine from the technique standpoint. But then she ended up dying because they gave her a type A lung and heart in one of the most prestigious medical cardiac centers in the States. So we don't know the magnitude of the problem in Saudi, but I like to point to this study. So this study came out last year in the BMJ. And what that study shows is every year, 251,000 Americans die from medical errors. So that makes it the number 3 cause of death in the United States. I'm a Canadian and American board certified surgeon, so I've practiced in the States, and if you حط تحتها خطوط, if the healthcare system in Saudi is similar to the healthcare system in the States, every year in this country, 22,000 people die from medical errors. This translates into 60 to 70 people. So today, at least 60 to 70 people will die in this country from medical errors in different specialties, and probably some of you might say more than that if you look at the entire country. That's the tip of the iceberg. So death is the ultimate harm, but you can have major harm, you can have minor harm, you can have a near miss. So the problem is big. It's a global problem, and I think we need to start working on solutions for this problem. My brother is a pilot in Saudi Airlines. I'm ashamed to discuss the situation of safety in our healthcare system, in our system compared to their industry. The likelihood of dying in an airplane is like less than 1 in 20 million. The likelihood of dying in a hospital is, if you're a patient, is 1 in 300. So you could see here that healthcare is probably as dangerous as bungee jumping, if you've seen bungee jumping before. And decades ago, aviation was not as good, but they have actually started talking about, we have a problem, and then they are now one of the safest industries on the planet. And I think we can transform our system to become a safe system, and I think we as Saudi Arabia could take a leadership in this area. Again, there's medical errors not only just cause death and harm, but there's also a financial component to it. And when all the studies that looked into the economics, they only calculate the medical and pharmaceutical. And again, another tip of the iceberg. You've got an indirect cost and you've got an opportunity cost without getting so technical. So my colleague, Dr. Reem, mentioned the NTP 2020. I just want to kind of highlight this as one of the Vision 2030 objectives. So average life expectancy, if you want to increase that from 74 to 80 by the year 2030, that is huge. And we need to be focusing on stories like the one I mentioned, on how can we reduce maternal mortality, how can we reduce infant mortality, how can we reduce road traffic accident-related mortalities, and other kind of harm that could happen to our patients. Again, I'm going to skip this, but because it was discussed, but the transformation program and the healthcare transformation activities that are taking place are kind of modeled after the 6 building blocks of the WHO and the way they look at healthcare systems. So just keep in mind that healthcare systems are means to an end. So it's about improving health status, it's about improving public satisfaction, it's about doing that in a cost-effective way. So the Saudi Patient Safety Center, this is the healthcare system in Saudi. So you've got the Saudi Health Council as the umbrella for the regulators and the providers, and you've got these different regulators. The Ministry of Health, the Saudi FDA, Sabahi, Saudi Commission for Healthcare Specialties, and the CCHI, which regulates private insurance. And then 60% of healthcare is provided by the Ministry of Health, 10% is by the other government sector, non-Ministry of Health, and around 30% is by the private sector. And with the transformation, with the kind of private sector participation, There's a role for the private sector to grow, and then we're going to end up also with an entities, the PPP, the public-private partnerships. So these are hybrid, public and private. So we see that the Saudi Patient Safety Center, we're at the positioning phase. We're trying to kind of position it not as a regulator, but as kind of an enabler within this ecosystem on working closely with the regulators. And if we want to kind of summarize what we are going to be doing, it's to work with through three channels. One is working with the regulators and the government agencies, and there's a lot of activities with each one of those regulators there. One is working with the providers, public and private, as well as community pharmacies, and we have started a medication safety program, and there are some activities within community pharmacies around medication reconciliation. And I think the most important thing is working directly with the public. So how can we empower patients not to kind of keep focusing on after the fact, on after harm happens? How can we empower patients to reduce harm? How can we tell patients what to expect when they're undergoing an informed consent? There are many surgeons here in this room. Are we doing informed consent in the proper way? If you ask yourself, if your family member, if you as an individual having surgery, would you want to know all the components of the informed consent in the proper way so you can make an informed decision? It's not about what we do now, many of us, which we choose for patients. So our vision is safer healthcare for all. The mission is, this is a mouthful mission, but it's pretty much eliminating preventable harm by working with all stakeholders. We've got 4 values. Number 1 is the most important one, patient-centeredness. It's not about us. Healthcare industry, unfortunately, it's not a customer-centric industry, and this is not Saudi, this is the healthcare system. So how can we empower patients, move from the paternalistic approach of kind of looking down on patients to actually make sure that they're involved in decision making, and everything that we do should revolve around them. I think what you guys have done in creating the society is a testament to your interest in patient-centeredness, because even though there are these frictions between orthopedics and neurosurgeons and physiotherapists and others, I think this shows your willingness and interest in taking leadership in pushing patient-centeredness forward, because again, you care about the spine, whether you're an orthopedic surgeon or a neurosurgeon or a physiotherapist. And I don't think we have a time for going through the strategy map, but the whole idea is my presence here today is as part of a collaboration. So we want to collaborate with local entities, and there's a lot of collaboration that we're also undergoing with international entities, the WHO, Johns Hopkins, and the IHI, Canadian Patient Safety Institute. So the way we want to do things is we do not want to reinvent the wheel when it comes to patient safety, and the Saudi Patient Safety Center, you could think of it, you've had your previous meeting, لجنة العموم or whatever, the assembly meeting. I consider that all the hundreds of thousands of healthcare professionals, and I consider all the 32 million people as kind of associated with the Saudi Patient Safety Center, because we all have a vested interest in making sure that our healthcare system is safe. And if you just ask yourself this simple question every single day, if it was me, if it was my most beloved family member, how do I want them to be treated? Just ask yourself that question, and you're going to do the right thing all day, every day. So how can, I've got just a couple of slides. So how can the Patient Safety Center help with the transformation? So at the national level, actually 2 weeks ago, we launched an important initiative. It's called the National Patient Safety Award. So this award will have healthcare It's going to be our Oscar in Saudi. So it's going to have healthcare facilities categories, physicians categories, and, sorry, not physicians, so healthcare facilities categories with all the different types of healthcare facilities. The best hospital, the best primary care center, the best ambulatory care center, and the best community pharmacy. And for the healthcare professional, we have the best physician, the best doctor, the best nurse, the best manager, and there are some other categories as well. And the third category is the community, the best person from the community which contributed to patient safety. We intend to have our meeting, our international patient safety meeting, either towards the end of November or early December next year. And that time, the Minister of Health is going to hand over the kind of the trophies for the winners. We're putting together an international and national experts refereeing committee. We already have someone like Sir Liam Donaldson from the WHO sitting on this refereeing committee. We're reaching out to someone like Don Berwick, and we're going to also have some senior and experienced people from Saudi as well to be part of this committee of referees. And we are going to use this award to kind of as a tool to align with all the other transformation activities that are taking place. Again, at the provider level, it's about training. There's major emphasis these days on interdisciplinary training. So even though we are trained as individual specialties, we're expected to function as teams. So you've got I call them the tribes, you know, the surgeons' tribes, the anesthesia tribes, and the nurses' tribes. And everyone has their own thing. And even within the surgeons' tribes, you've got the orthopedic tribes and the neurosurgeons' tribes. But it's not about us. It's about patients. You know, we made a mistake a few months back where there was a tweet that came out that got the physicians to go against the pharmacists and the pharmacists to go against the physicians. And I was going through those tweets, you know, this back and forth, this very interesting tribalism. There was nothing mentioned about patients. And it just tells you about, you know, where we are as an industry. It's not about us. You know, it's not about us. It's about the patients. I would have loved to have, you know, this back and forth about how can we make sure that it's for patients' care. So I'm going to end with this slide. If there's nothing else that you could remember from this talk, you know, please remember patient empowerment. You know, patient empowerment. How can you empower patients to become actively involved in their care instead of just having this current paternalistic approach to their care and how we deal with them. I'm going to be around again for Q&A. Thank you very much.